Oh, ain't nothing wrong, okay?
Hello, everyone, and welcome to this episode of the Black Scientists Cooperative. In honor of Mental Health Month, we have a special guest, Dr. Valdesha DeJean, and we're going to be talking about mind maintenance, a very important topic, especially in the Black community. So, Dr. DeJean, if you could just tell us a little bit about your background and how you came to get into this space, the field of mental health.
Okay, yes. So as you just stated, Dr. Valdesha DeJean. I am originally from Atlanta, Georgia. And after moving from Atlanta, I went to college at Xavier University, training at Baylor College of Medicine. And I think that my entry into the field of psychiatry started very early on. As a little girl, I had a member of my family who suffered with schizophrenia. And I would ask family members about what's going on with him. And a lot of times the answers were met with, the questions were met with silence, or maybe distracting me away from the question onto something else. And it really piqued my curiosity to figure out what was going on with him. And as a result, I became more and more invested in understanding and learning about psychiatry. So it was kind of a purpose coming out of pain type of situation. So that has sparked my interest, and it's been a great passion of mine to this day.
So we know that after Meharry, you did your residency in psychiatry, and now you are a practicing psychiatrist now in Atlanta. And so as a psychiatrist, can you help our viewers understand exactly what your role is, and how do you diagnose an actual disorder? What signs do you look for?
Okay, yes. So my role as a psychiatrist is to essentially assess and treat patients who are struggling emotionally or sometimes even cognitively. And the way I go about that and my approach is to really start with hearing the story of what led them to the office. Why are you here? What's bringing you to a place of despair? And as I'm listening to their story, I'm then asking questions about certain symptoms to assess if there's been a change in their functioning. And as I'm doing that, I'm trying to see, are you functioning differently in the workplace? Are your relationships changing as a result of these symptoms? Or if you're a student, are you suffering in school? So I'm looking for impairment, and I'm looking for signs of distress. And there are certain symptoms that we can look for in detail, like sleep and appetite and your enjoyment and activities, zest for life, changes in your thought patterns. But in general, for me, it starts with the story and what has shifted for that person.
I mean, so it sounds like everything that you're describing is something that most people feel, right, on a day-to-day basis in some capacity. It seems like it's a matter of if you're starting to tip maybe excessively to one side of the spectrum. Would you say that's true, or?
Yes, that's true. I mean, we all have moments of distress. I think what we're looking for as psychiatrists is to see if that distress is prolonged. Is it taking a toll on yourself, on your relationships? But it's very important to note that many people come to see psychiatrists and therapists just to check in with themselves and to monitor and see it as a form of just kind of regulating or even prevention. There are several people who I see for psychotherapy that don't actually have a mental health diagnosis per se. They may just be having difficulty adjusting to some major change in their life. So I think that is a big myth and very good question that you pointed out, because you really don't necessarily have to be totally distressed or in despair or impaired to actually present to the office to get support.
I think that's a big part of the stigma around, getting care in mental health, is that people assume if they proactively go out and seek these solutions, then they'll be labeled in a way that's negative. What are some common mental disorders that you see affect the Black community maybe more disproportionately than other communities?
Well, one thing I specialize in my practice is in trauma and PTSD. So I would say, just because of my specialty and expertise, I'm more likely to see people who have been traumatized. But honestly, my interest in that sparked in residency when I was seeing people not get better, and it just wasn't making sense. Like, all these drugs aren't working. They've done a lot of therapy and nothing's working. And the underlying root that was there was trauma. And, it's more significant for Black people because, not only are you just dealing with your own childhood issues or, life experiences, but that is layered with the trauma of racism. Now, a lot of people don't always conceptualize racism as trauma, but it is. To wake up and to see images of people that look like you being hurt on the screen, and to be inundated with, messages of inferiority and brutality. So I would say that is a diagnosis that is sometimes underdiagnosed and maybe misdiagnosed, PTSD specifically, because patients, they're seeing the depression, but they're not reporting the trauma. And so it sometimes takes people a while to even say, hey, yes, I was sexually abused as a child, or I was physically abused, because that develops trust. So for that reason, people aren't always as transparent, and then the diagnosis gets missed.
So
I would say PTSD is seen a lot in major depressive disorder, as well as other anxiety disorders are very prominent in the Black community.
So when we look at that PTSD, those anxiety and depressive disorders in the Black community, would you say what would you say the demographic breakdown is between men and women, and young people versus older people, if you have any experience with that?
So the last time I checked the data on prevalence of different mental health diagnoses in general, most of the data shows that it's kind of equally distributed among races. However, there is some data that suggests that Black people specifically are more likely to be misdiagnosed with schizophrenia. So for that reason, the data is skewed. So sometimes the more severe illnesses are attributed to Black people. So, and there have been times where I've even retrieved patients from other providers where they may have had PTSD, but they were misdiagnosed as bipolar disorder. So a lot of times we are misdiagnosed. So it's really hard to really discern true accuracy with that data. But in general, the prevalence is about the same across races.
Is that a function of practitioners not understanding the cultural background or context of the patient, you think? Or
Absolutely. There are issues with cultural competency, and sometimes just general lack of knowledge or ignorance about some of the cultural norms within a race, right? So there's this excellent textbook in cultural psychiatry, in which one of the psychiatrists actually give an example of how a woman was misdiagnosed with bipolar disorder because she was assumed to be manic. And the reason why she was assumed to be manic is because she dressed in very colorful clothing. So she had, orange and very vibrant colors. She was very talkative and outgoing. And there was a difference in the cultural perception of her emotional state. So she appeared to be, to that psychiatrist, is very hyped up, very energized and happy to an extreme, and was assumed to be manic when she actually was not. That was her baseline level.
So it sounds like who you choose to go see for your care is very important, because it seems like there's a fine line between one condition and the other. And then that fine line seems to be, in some cases, determined by a little bit of subjectiveness on the part of the mental health care professional. Because you, like you say, if you don't understand those little new cultural nuances, you'll misinterpret or even miss something which might sway you to diagnose a patient with one that when in actuality that patient has a different condition. And it doesn't have anything to do with the patient, but it seems like it has something to do with the selection of the care provider. And so that kind of makes me think about how would you suggest to our viewers that might want to seek help go about finding the right person to care for their mental health?
Right. That's an excellent question. First, I do want to, put out a disclaimer that there are some white colleagues of mine and, psychiatrists of other race who do an excellent job of being culturally sensitive and curious. I think that's the piece. If you end up, for some reason, you're in a city or a state where you can't find another provider of the same race, sometimes that's just not always logistically possible. What you want to look for is someone's really curious about the experience and having enough humility to ask questions about your experience, right? Not just jumping to conclusions. So there are some people who can do it quite well, but the humility and the acknowledgement that they don't know everything is what is the key to making accurate diagnosis and to not jumping to erroneous conclusions, right? But with that said, there is the issue of safety, right? Someone must feel emotionally safe to go to another provider, right? And to really be there. And the most important thing is the Therapeutic Alliance, right? So we've seen research that treatment is most successful when there is enough of an alliance there with that provider. So what is important, if that's important to you to feel understood, especially if there's some cultural or issues with racism or things personal in that way that you need to address, then it is good to try to search for a minority or another Black psychiatrist or therapist. And there are great resources out there now that we didn't have in the past to do that. There's a network called BEAM. There's Therapy for Black Girls that has a directory of all the therapists and psychiatrists in different cities around the nation. There's Therapy for Black Men. And then there's even local, like NAMI, the National Alliance of Mental Illness. They can kind of find local people in your area. When you ask them based on the demographics of what you want, they can help find that. And Depression Bipolar Support Alliance, also known as DBSA. So now there are more directories and research. There's also a network called Psychology Today, where you can actually click in the tabs and filter out, I want a female, I want a Black female, I want someone over the age of 30. You can filter all of those things out to get someone made for you. And I think it's important to, when you're looking for a provider or psychiatrist or therapist, to actually read what they say about themselves and what's important to them on their profile. Mm-hmm. A lot of times people can really connect with what they're saying and can tell just by reading what's their philosophy, if that's something that fits for them.
Yeah, we mentioned it on our last episode concerning this, that on that like Psychology Today site, you can even say, I want a Christian therapist.
That's right.
Or a Christian psychiatrist, because, a lot of times mental health and faith are diverging messages, and the two can actually go hand in hand. depending on the provider that you identify.
That's exactly right. It's been a great resource, and a lot of patients who are minorities have found me through that website, Psychology Today.
So, I know that, you have a history of having worked in a safety net hospital in Texas. And I know that that hospital sees a lot of patients that don't have appropriate resources to continue care. So, what does some potential treatment plans or coping strategies, especially for those that may lack some consistent opportunities for resources and reaching out, what does that look like for that population, or for individuals without resources or consistent resources?
Right. It's funny because I have heard patients really get resourceful on their own and be creative. The most wonderful story I heard is a patient, she really couldn't afford a private practice rate, but there was one doctor she really wanted to see because the doctor had a very good reputation. And so she created a GoFundMe page. She told her story online on Facebook and said, I need help. This is my story, and she raised over thousands of dollars for her mental health care. Now, everyone doesn't have that kind of wherewithal to think about that, but I guess what I'm pointing out is when you really prioritize something, sometimes you can get creative and find a way. Another resource I've heard patients do is to go to their local church community and say, I'm struggling, can you please help me? I have several patients who I get paid through the church. And there's, agreements made contractually through church communities. But I also think you can rely on those local networks like NAMI and DBSA too, to help you find care that's local and built in. One thing that's also striking, that there are a lot of patients who are eligible for Medicaid that don't realize they're eligible or don't know how to sign up for that. But, that's a start. Like, you get on Medicaid and you can get some of the underserved population, the services that are geared to that. And recently, because of this mental health crisis, there have been a lot of counties and cities that they have community service boards and places where you can actually go to get free care. So there are things out there. It's about kind of really getting aggressive and really trying to tap into your network to see what you can do. And there are some providers that provide sliding scale services as well. So you can actually look for that too when you're doing your searches on places like Psychology Today.
You know what? It's interesting because I'm so glad that the time has come where we have these resources available and that we're starting to talk more about it. As you mentioned earlier about, your experience of how you got into wanting to be a psychiatrist, it made me think of I had an uncle, and I just remember growing up, was told that because I never met him. And he was from, my grandmother had 10 kids, and this was my mother's brother. And I heard stories about him, but I didn't meet him. And they just said, he has schizophrenia. And it's like, okay, asking questions like, at that time, what does that mean? And I would hear stories of things that he did and how he would leave, and, they would randomly find him somewhere, and it never was talked about. It was like, so I think fast forward into now where, it's starting to open up and people are starting to talk about, their traumas and talking about this, it's definitely, we're moving in the right direction. So one of my questions are, how do we stop the stigma associated with mental health and normalize getting help? Because I think, too, thinking of myself and thinking about normalizing getting help, I think of when you mentioned earlier about, having PTSD and going through like trauma. And if I could share a story, a personal story myself, we have a son that have a congenital heart defect. And it has been definitely an experience and an emotional roller coaster. And, when you're going through a trauma, you don't really recognize that you're going through a trauma because you're trying to get through it. And one of the things that I experienced was when I realized that I was experiencing some PTSD from our long hospital stays, long surgeries and being in the unknown. And I can remember going to an appointment, a doctor's appointment, and we were headed towards the hospital and going into the parking garage of the hospital. And I completely just like a overwhelming amount of emotion came over me. And I just started not feeling myself and started panicking. And I was just going into the parking garage, but it was bringing up all these type of emotions that, we were going through at the time, that we wasn't, the constant going in and out of the garage, just having to tag team with my husband just to be there for him. And I wasn't really talking about it because, you're trying to just get through it. And it just took one day of somebody said, this is normal. You had a traumatic experience. So, so I guess to come back to the question, how do we normalize this and how do we stop the stigma of that, is, to get back to, it's okay to have these feelings and there's help out there for you.
Well, first of all, Dr. Williams, I just want to first of all thank you for that transparency. And you've already exemplified one of the things that needs to happen with stigma is to be transparent, to talk about it, right? We have got, as a nation, as a people, as a race, we have got to stop colluding with stigma in silence. So your courage, your bravery just right now is an example of what we need to do. There are so many people that suffer in silence, and silence perpetuates shame. And that is what's perpetuating the stigma. When enough people say, hey, this is happening to me, then it does become normal, right? It is normalized. So I think what you've done and what other people doing, I always cheer for joy every time I hear a famous person or a public figure who's well respected, who speaks out on mental health. That's a game changer for the field of psychiatry. So normalizing by speaking out and no longer being in silence helps with stigma, especially if it's a figure that's well respected, because what people then internalize is if Michelle Obama says that she's depressed in the pandemic, then surely it's okay that I'm feeling this way. That's just how people connect, And so this is an example of one thing, but also with stigma. I can talk about stigma all day long. But what I look at when I'm trying to solve a problem is what's the root of the problem. So one of the root causes is fear. I'm afraid of this. Like you said, it's subjective, it's ambiguous. You can't see it. You can't get a lab like other fields of medicine, right? So I'm afraid of this. So then I feel helpless. So then because I'm helpless, then I'm in denial because I don't want to acknowledge, right, that this is happening because it's scary, just like you just mentioned, right? So then I push it away. So when we understand that we are afraid, then now what do we do for that fear? We educate ourselves. And the education helps us to feel more empowered so that we don't have to feel so scared, So that's one thing when I think about stigma, I think about fear. And then there's this other piece. These judgmental people who have the nerve to judge people for their mental health illness. If you really think about it, those are people who haven't acknowledged their own vulnerability. Because no one's just invincible from mental health issues, if you really think about it, right? And the pandemic has clearly demonstrated that. people who you may have never thought would be suffering emotionally are now suffering, because a crisis can happen to anyone, right? That can shake you up and shake your stability and your equilibrium, right? So what I'm thinking in terms of the vulnerability is like, if you don't acknowledge your own vulnerability, then it's very easy to be judgmental of other people. So acknowledgement of your own vulnerability, just like cancer, like, you know, sometimes people are at risk of cancer because there are people in the family history that have it, right? But sometimes people get cancer and it's just rare, and you're like, well, how did you get that? Like, how did you get lung cancer and you don't even smoke? You know, the same can happen with mental health issues, right? So I think if more people could acknowledge their own risk, then they wouldn't be so judgmental of others. I've heard people say, oh, I don't have to worry about that because, you know, I don't have anyone in my family with mental health. And the truth of the matter is probably you just didn't look far enough. You get
Exactly.
somebody.
Right.
Nobody told you.
It's you.
So no, seriously, but yeah, so acknowledging that vulnerability in ourselves so that we can be more compassionate and empathic for other people. So then here's a big one. A lot of times the stigma is perpetuated within our own religious communities. And that's unfortunate.
Yeah.
I can't tell you how many times I've sat in a church where the pastor says, you need to pray, you don't need to take that medicine. You know, all of these type of things that make people feel like they're a bad Christian if they're suffering emotionally. The narrative of you can pray it away, you aren't strong enough, oh, I'm being punished for my sins, or I'm demon possessed. You know, unfortunately, these things still carry on. We're doing better. You know, we're moving into the better place. So one of the ways I think about addressing, when I was in Houston, Texas, I did some work with clergy members, and we had forums so that we could all get on the same page about stigma and also addressing these mental health needs and making sure the education was put out there so that we're not sending messages that keep people away from getting the help that they need, you know?
That is so true, because you cannot compartmentalize healthcare. So, you know, if you were having a heart attack, no one would tell you to pray away that heart attack. You know, the ushers would be running it down 911 as they put a handkerchief across your leg and waited for the ambulance to come. So, you know, it's like you can't compartmentalize which you know, illness you need medical treatment for. You just can't do it. The brain is an organ just like the heart, just like the lungs, just like the kidneys, you know,
Right.
and it requires maintenance.
Right. And where did that heart attack come from? Was there some underlying depression and anxiety perpetuating you to be at risk for the heart attack, right? It's all interconnected, and people try to separate it out, as you mentioned, and it just doesn't work that way.
You cannot. Well, look, this has been an amazing discussion, a very enlightening discussion.
Yep.
Viewers, I hope that, you know, if you don't take anything else away from this episode, that you understand it's okay to need help, to ask for help, you know, and to want to get help, and, you know, to set aside worrying about what other people may think of you if you do decide to pursue help. I mean, Shantae shared her stories on the previous episode. I shared my stories, you know, about how, again, you know, exercise is for the body, you know, therapy is for the health of the mind, you know, and if you're a spiritual person, God is how you take care of your soul. And so all these things factor into overall wellness. And we, especially as Black people, you know, need to be virulent, and we need to be diligent about taking care of ourselves, because who else is going to, right? So, Dr. DeJean, we thank you so much for being our special guest. You have really dropped some jewels on us today. We hope that we can have you back at some point down the line for the podcast. Thank you, viewers, for joining us. This is another great episode of the Black Scientists Cooperative. Yes, wonderful. We'll see everyone next week. Good night.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life bright. I'm so glad that you're mine, yeah.